HPV is the most common sexually transmitted infection. Almost all females and males will be infected with at least one type of HPV at some point in their lives. Most people never know that they've been infected unless a woman has an abnormal pap smear with a positive HPV test. Most infections, as you can see on this slide, happen during the teen and college age years. HPV is transmitted through skin-to-skin contact through vaginal, anal, or oral intercourse. HPV exposure can occur at any type of intimate sexual contact. Intercourse is not necessary to become infected. Nearly 50% of high school students have already engaged in sexual, which is vaginal penile intercourse, as shown here. For example, a third of 9th graders and 2/3 of 12th graders have engaged in sexual intercourse, and 24% of high school seniors have had sexual intercourse with 4 or more partners. This line graph shows how quickly HPV infection occurs after first intercourse. Genital HPV infection occurs frequently in women within 1 year of their first male sex partner. Some women acquired a genital HPV infection prior to having vaginal intercourse, suggesting that they may have had non-penetrative sexual contact. Young women are at high risk of acquiring HPV infection from her first male sex partner, and the risk is increased by the partner's prior sexual experience. Even if a teen isn't having sex, they may be engaging in behaviors that can expose them to HPV. Even girls who report never having sexual intercourse still had, in this study, HPV infection. This slide demonstrates a study that examined the frequency of vaginal HPV and the association with non-coital sexual behavior in longitudinally followed cohort of adolescent women without prior vaginal intercourse. And HPV was detected in 46% of women prior to first vaginal sex. 70% of these women reported non-coital behaviors that may in part explain genital transmission. Cervical cancer was once the leading cause of cancer death for women in the United States. Now it is the most preventable of all of the female cancers. The Pap test has helped decrease the number of women in the United States with cervical cancer by about 75% in the past 50 years. However, even with an excellent cervical cancer screening program in the U.S., there are still around 12,000 cases of cervical cancer each year in this country. Many people think of gynecologic cancers as just affecting older women, but cervical cancer affects 1 in 6 women who are in the prime of their reproductive years. And you can see these data illustrated in the slide. Almost 26% of cervical cancer occur in women who are between the ages of 35 and 44, with 14% between ages 20 and 34, and almost 24% between 45 and 54. Most oropharyngeal cancers that were previously thought to be caused by tobacco and/or alcohol use are now being identified as HPV-related cancers. The number of oropharyngeal cancers diagnosed that are not caused by HPV has declined by half. The prevalence of HPV oropharyngeal cancers has increased from 16% in 1984 to 89 period to almost 2% in the period from 2000 to 2004. Population-level incidence of HPV-positive cancers increased by 225%, while HPV-negative cancers declined by 50%. So if the trends continue, the annual number of HPV-positive oropharyngeal cancers is expected to surpass the annual number of cervical cancers by the year 2020. We don't have these data yet, so stay tuned. Now here are 2 graphs from the CDC illustrating anogenital warts and the prevalence per 100,000 person years. So the prevalence of anogenital warts was examined using healthcare claims of privately insured females and males in the ages of 15 to 39 years, and this shows the period of 2006 to 2014. The prevalence among adolescent females ages 15 to 19 years declined, but it was non-significantly during the 2006-2008 period, and then significantly decreased through 2014. Focusing on women ages 20 to 24, genital wart prevalence was stable in the 2006 to 9 period, but declined significantly during 2009 to 14. Prevalence among women 25 to 29 years also decreased significantly in the 2009 to 14 time period. Prevalence increased or was stable during the entire period for women ages 30 to 39. Now, focusing on the males, which is in the lower part of the slide, anogenital wart prevalence increased significantly during 2006-9 for all age groups except those ages 15 to 19. And you can look at the various breakdown if you're interested. Now, the annual prevalence of high-grade histologically detected cervical intraepithelial neoplasias, or cancers, grade 2 and 3, during 2007 to 14 was estimated using healthcare claims from 9 million females ages 15 to 39 who received cervical cancer screening in a given calendar year, and this is reflected in the CDC data shown here. The prevalence of CIN2 or greater decreased significantly in women 15 to 19 and 20 to 24 years of age. Among the 15 to 19-year-olds, annual percent change in CIN2 or greater was almost 20% less during the 2007 to 9 period and 12% less during the 2009 to 14 period. If you look at women from 20 to 24 years of age, the annual percent change decreased almost 7% during this 2007 to 12 period, and then almost 13% during the 2012 to 2014 period. And there was no decreases in CIN2 or greater observed in women aged 25 to 39 years. So here we see the cost of HPV-associated disease in the United States, taking into account the burden of the cancers and other HPV-associated diseases. The total cost of HPV-associated diseases is $8 billion, including the $6.6 billion due to routine screening. With new technologies, it's hoped that there can be more efficient screening, augmented by more organized screening systems, and of course, vaccination, leading to reduction of the screening costs. Estimates of the direct medical cost attributable to human papillomavirus can help to quantify the economic burden of HPV and to illustrate the economic benefits of the HPV vaccine. Treatment of cervical precancer and cancer can lead to many complications in women, particularly of childbearing age. For example, cervical cancer is often treated by hysterectomy, leaving many young women unable to have any or additional children. High-grade or severe precancerous lesions often require treatment that can cause cervical incompetence or cervical stenosis. And cervical incompetence can lead to preterm delivery, and cervical stenosis can lead to birth complications. And both of these lead to tremendous burden on the mother, the infant, and the family.